rapid access to comprehensive oncology data and survival analysis. This is the OncoToolkit.
Hello, everyone. Today, I saw a patient who was newly diagnosed with acute promyelocytic leukemia. She asked, "Doctor, what does my blood count mean for my risk?" Rather than looking at the numbers separately, let's take a closer look. Our patient is a 52-year-old woman with newly diagnosed, molecularly confirmed acute promyelocytic leukemia. At presentation, her white blood cell count is 6.8 times 10 to the 9th per liter. Her platelet count is 28 times 10 to the 9th per liter. Let's assess her baseline relapse risk group using the SANZ Risk Score calculator in the OncoToolkit. The original SANZ classification uses pretreatment white blood cell and platelet counts to classify newly diagnosed APL into baseline relapse risk groups. Let's enter our patient's information. First, enter the presentation or pretreatment white blood cell count. Her WBC is 6.8 times 10 to the 9th per liter, so we'll enter 6.8. Next, enter the presentation or pretreatment platelet count. Her platelet count is 28 times 10 to the 9th per liter, so we'll enter 28. Now click Calculate Score. Here are the results. This patient is classified as intermediate risk, according to the original 2000 SANZ relapse-risk classification. Her WBC is not greater than 10 times 10 to the 9th per liter, so the calculator proceeds to the platelet threshold. Her platelet count is 28, which is not greater than 40 times 10 to the 9th per liter. This combination results in the intermediate risk classification. Under how this result was calculated, we can see the decision pathway clearly. A WBC of 6.8 does not meet the greater than 10 threshold. The platelet count of 28 then places the patient in the intermediate risk group. For convenience, you can copy the result directly. You can also enter the patient's name and save the assessment within the platform. If you'd like to learn more, scroll down to the reference data below for additional guidance and supporting evidence. You can also expand the clinical workflow section for guidance on appropriate use and interpretation. For this patient, a WBC of 6.8 and platelet count of 28 result in an intermediate risk classification. For more oncology calculators and clinical decision support tools, explore the OncoToolkit.